Hello, I'm Dr. Gregory Davis, gynecologist in Chico, California. Just want to take a few minutes to talk to you about depression. In my practice, I see lots of women with depression, and we treat those women. And what I've done is just kind of come up with a little diagram that I thought would be helpful for you to understand what your symptoms are in relation to what type of medication that you may need to be on. So I hope this information is helpful. All right, let's talk about depression here, and I think it's important to understand that we have neurotransmitters in our brain that carry the signal from one nerve to the next, and what actually carries it from one nerve to the next is neurotransmitters, and there's basically quite a few types of neurotransmitters. The three that we know the most about are serotonin, norepinephrine, which is kind of like epinephrine, and then dopamine. So let's kind of look at what the symptoms are when you have low serotonin levels. And then it'll be kind of helpful to understand what may be associated with your type of depression. The first was serotonin. People that have low serotonin levels have anger out of proportion to a given situation. So when you see somebody that something minor happens and they just absolutely blow up and lose it, then I start thinking, you know what, they may have some low serotonin levels. So anger is the first one. The second one is OCD. Well, you know, when you see people that have obsessive compulsive disorder or behavior, you know, those are the people that, you know, if you're one of those people, you're adjusting everything and you're changing, cleaning everything and making sure it's perfect, then that can be a problem. Obviously, there's lots of physicians, and I'm being a surgeon, I mean, you want your surgeon to have a little bit of OCD, but obviously there's having too much OCD that can become a problem. So if you're having some of those, it may be low serotonin. The other is anxiety and panic. So when people have anxiety and panic attacks, that is usually related to having low serotonin levels. Now, when we look at what happens to people that have low norepinephrine levels, well, they're going to have fatigue. And people that have, this is an extreme fatigue. I mean, they can't get off the couch. They can't get out of bed. It's extreme. And people that have, patients that have chronic pain can also develop low norepinephrine levels. Now, dopamine, people that have, dopamine is kind of called the pleasure neurotransmitter. And those people usually, you know, when their dopamine levels are up, they're feeling great and everything's working well and they're doing really good. So, it's interesting. People that have low dopamine levels can have more of addictive type of behaviors. So, for example, people that alcohol is a problem, smoking is a problem, caffeine, people that do extreme sports, people that have gambling usually have low dopamine levels. So when their dopamine levels are up, they're feeling good and everything works well. So as we talk about the medications that are available to help, you'll kind of see how the medications are chosen based on which type of symptoms that you have. So the first medicine that came out for depression, and I'm talking about in the last 25, 30 years, is that we all know, of course, about Prozac. And so Prozac came out and helps raise your serotonin levels. And then there's Zoloft, there's Paxil, there's Celexa, there's Lexapro. And these are the most common. There's a few others, but these are the most common that you may recognize. So if somebody has put you on this medication, that's because they think, well, it's going to help your serotonin. If you're somebody that has an extreme amount of fatigue or you have some sort of addictive type of situation going on, you can see how these medications are not really going to help you. So we've all heard of people that have been taking Wellbutrin, and so Wellbutrin is interesting because it has some dopamine and it also has some norepinephrine. So you can see why Wellbutrin are those medications, there's several other names for it, but Wellbutrin type of medicines have been used for helping people stop smoking. Well, you can see why it works. It's helping to raise those dopamine levels. So what happens is that when somebody's a smoker and when they're smoking and their dopamine levels are feeling good and they're up, when they quit smoking and those dopamine levels drop, then they go back and smoke again. Well, if you're taking Wellbutrin and you're keeping that constant, then that's why it works fairly well in helping people to stop smoking. Now, what about people that have problems with chronic pain? Well, we know that there's some medicine called Cymbalta, which has some norepinephrine, and it's also got some serotonin. So it's going to help with some of these symptoms over here, plus it's going to help with some of the fatigue, and it's going to help with the chronic pain. And this has actually been FDA approved for that. We've all heard of Effexor, and Effexor is the same sort of thing. It's got both some norepinephrine and serotonin that it's going to help levels to raise. And then now there's the new medicine Prestique, and Prestique does the same sort of thing. It's helping both norepinephrine and it's helping serotonin. And now there's a medicine that has come out that is just for people that have fibromyalgia, and that's called Savella. And Savella has a lot of norepinephrine and a very small amount of serotonin. So you can see the people that have fibromyalgia, what do they have? They have a lot of pain, joint pains, muscle aches, and so they just kind of feel really kind of miserable. When they take Savella and you raise their norepinephrine levels, then it seems to help. It does have a little bit of serotonin. Now obviously, these medicines may not work for you, and obviously you need to see your provider before somebody prescribes a medication for you. But I think if you kind of understand why you have anger, OCD, or anxiety, it's related to low serotonin. If you have fatigue or chronic pain, it's going to be related to low norepinephrine. If you have addictive type of symptoms kind of going on, then you can see why that would be a low dopamine. So, in summary, I think it's really important when you're seeing your provider and you're talking about your symptoms of depression that they'll test you, they'll ask you some questions, and then they'll make a decision based on some medication. And when you look at this little chart here, hopefully that will help you to understand why that medication is working, or why in your case it may not be working because you're on something that doesn't really apply to your symptoms. All right, in summary, what I'd like to just kind of point out is that we've talked about medications used to treat specific symptoms related to depression. But what's really important for you to remember is that once your provider starts you on a medication and that medicine is working, it's really crucial that you stick with that medicine for about 8 months. Now, why 8 months? Well, that's what psychiatrists have studied, and they've shown that if you're on a medicine that's working and you bail out before the end of that 8 months, there's like a 65% relapse rate. So it's really important to stay for the 8 months. At the end of 8 months, then what normally we do is we slowly wean you off over a period of 4 to 6 weeks. And if you're doing fine, well, then it was just a bump in your life's road that you've gotten over with this medication. At the end of that 8 months, if we wean you off that medicine and all of a sudden you descend back into the same symptoms you were having before, well, it's good news and bad news. The good news is we've got some medicine to treat you. The bad news is you got to take it long term. So I hope you'll find this information helpful when you're seeing your provider and talking about your symptoms of depression.